Greetings. It is my distinct pleasure to chat with you about osteopathic manipulative medicine and osteopathic manipulative treatment at the Danto Osteopathic Clinic. OMT stands for Osteopathic Manipulative Treatment, and it is the hands-on manual approach that osteopathic physicians use to treat joint, muscle, and soft tissue dysfunctions in the human body. Osteopathic Manipulative Medicine, or OMM, is how an osteopath physician wields OMT in the treatment of disease. The body, mind, and spirit philosophy of osteopathic medicine was first enunciated by Dr. Andrew Taylor Still, who is an MD. He had some unique experiences that showed him the role of the musculoskeletal system in health and disease. In his autobiography, Dr. Still recounted how during childhood he cured his own headache by lowering a rope swing near to the ground to use as a pillow. He was amazed to discover after a 15-minute nap that his headache was gone. Experiences like the rope swing laid the fertile ground for an ambitious Dr. Still to attempt other methods like OMT to normalize the musculoskeletal system. He began a deep study of the anatomy of the body and its mechanics. As he observed what was normal and abnormal, the encouragement of the body to return to normal through a gentle force like OMT became more evident. All physicians are trained in physical examination of the musculoskeletal system, but Dr. Still made sure that osteopathic physicians asked the why question about their findings. And he wanted osteopaths to know a variety of approaches to improve musculoskeletal dysfunctions using OMT. In this way, he felt that osteopathic physicians were to be similar to mechanics in addition to our medical and surgical training, for the most complex machine that anyone could ever conceive. In practice, OMT may be applied in two basic ways, which we refer to as direct and indirect techniques. A third, more complex way is achieved by combining direct and indirect techniques. From those three basic approaches, there has been hundreds of techniques developed, but in the US, we have about 15 standardized techniques. All OMT techniques are valid and effective. Different osteopathic physicians possess a reasonably wide range of skills through which OMT may be applied depending upon one's natural abilities, their training, and their clinical experience. I'd prefer to think that I am advanced in all of those areas, but the more I learn, the more I realize that there is always more to know. Direct technique OMT refers to techniques that engage the barrier to motion directly in a head-on manner. There are various ways of doing this, including pushing right through the barrier like the joint popping techniques that are more often associated these days with chiropractic. There are other ways of engaging the barrier through where one may reflexively coax the body into allowing a release. Even a Swedish massage typically engages the barriers to the motion of the soft tissues directly. And here I am demonstrating a direct technique of the soft tissues on my neck. Please observe that it looks very gentle and relaxing even though it is a direct technique. With the indirect techniques, a clinician identifies the barrier to motion and then takes the tissues in the direction the body prefers. To demonstrate an indirect technique on myself at the base of my skull, I take the tissues the direction they want to go. I may move my head in that direction to reinforce the softening of the tissues, and then I may wait for the tissues to release or use my own respiration to finish the release. Most often, I examine it and listen to what a person's body is trying to tell me. Then I will apply some indirect techniques. If the body responds, then I may not have to do anything else. If the body doesn't respond completely, then I decide on applying a direct or combined technique. Once the desired mechanical change is attained, then I examine and treat any remaining impediments to neurological, vascular, and lymphatic function. In this video of me treating Dr. Debbie, I'm demonstrating a technique that combines both indirect and direct OMT. It's a technique that has been attributed directly to Dr. Still. He preferred that we examine our patients, find the pathology in the anatomy, and an osteopath should be able to divine the correct treatment based upon their understanding of the anatomy and biomechanics. Some people refer to the application of OMT in this manner as traditional osteopathy or classical osteopathy. And I think that adds some clarity. For me and other specialists in my field, this time-honored approach is the cutting-edge practice of neuromusculoskeletal medicine. Thank you for taking the time to learn more about OMM and OMT at the Danto Osteopathic Clinic. Our goal is to use our training, experience, and skills, as well as the evidence base, to help normalize and optimize you to thrive in body, mind, and spirit. Thanks.